Hey, this is Dr. Ty from Premier Orthodontics. So on our channel, we get lots of questions in the comment section. In this video, we're going to be answering some of these questions, hopefully give you some more insights on some of the more common questions we get about orthodontics. So if you haven't yet, make sure to like the video, subscribe to the channel, and tap the notification bell if you'd like to get notified when we release new videos. So let's go ahead and jump in here. This first question, it says, is TAD safe? Looks very painful. What are the side effects? How long does it take to finish the treatment? How old is a good time to do it? So for those who aren't familiar, a TAD is short for a temporary anchorage device. And what this is also called an orthodontic mini screw. Basically, it's a tiny little screw that gets placed usually between the roots of the teeth into the bone. So you may wonder why we would use that. So whenever we move teeth, you always have, with physics involved, if you try to move a tooth one way, another tooth is going to move the wrong direction. There's always an equal and opposite force. So if we place a TAD, or a temporary anchorage device, into the bone, we can anchor the teeth to not allow them to move. So if we want to move one tooth but not allow other teeth to move around it, we can be very specific and use that TAD to push against that screw rather than trying to push against the other teeth. So this is a helpful tool. We use it from time to time depending on what type of tooth movement we're trying to do. So the question is a TAD safe? So they are very safe. They're very straightforward. Basically, when the TAD is placed, we place a little topical jelly on the gums, and then we'll usually use a small shot if you've ever had dental work done, such as a filling, an extraction. It's similar to that. It's a small little shot in the gums. Again, no one loves this, but it's not too bad. And usually you just need a tiny little shot. It pinches for a second. And once the tooth and the gums are numb, you really don't feel the TAD at all. So the TAD takes about 10-20 seconds to place. It's very quick and easy. It's basically like placing this tiny little screw into drywall. So it takes less time than that. Is it safe? The only real side effect that may happen is there's a small chance that you could place that TAD and touch a root of a tooth. If that happens, it's usually not too big a deal. The tooth generally heals fine. It's really not very common, and if it does happen, usually the worst case scenario is that TAD will likely fall out because it is resting against the root of a tooth. So it's not really an issue. It would be pretty hard to actually place it directly into the tooth root. Usually when you're placing the TAD, it doesn't go in if you're touching a tooth, and so you back it back out and place it in. But generally speaking, we place these where there's lots of room and lots of bone. There's not really any issues. So what are the side effects? So the most common things that can happen with it is you might get some inflammation of the gums around the TAD. So especially if you aren't taking really good care of your teeth, if you're not brushing and flossing and keeping everything clean, the gum tissue can start to get puffy and inflamed. And if you have that TAD sitting there, it has a tendency to collect more food and food debris. And when that food debris is sitting on top of your gums don't like that a lot. They start to get puffy and red and, kind of like a small infection. That's what gingivitis is. And so that is the most common side effect is if you're not cleaning the area, it can definitely get some red puffy gums. When we remove the TAD, when we're done with it, those tend to resolve on their own. Other side effects, the most common thing that happens is they do sometimes get loose. So generally we will start pulling against this TAD right away. And sometimes 3 to 4 minutes into the process, that TAD might get loose. If that happens, it's not a big deal. We usually will just get the area numb, take it out, and put it back in somewhere else and continue on. And it's not really a big issue. So how long does it take to finish the treatment? This is definitely depending on what we're trying to do. So if we're trying to close a molar space and pull a lower molar forward, that might take a really long time. If we're trying to just do small movements, that's not going to take very long. So that really depends on what your teeth need and what tooth movement is trying to be accomplished. And how old is a good time to do it? Generally, we only use these if someone is in full braces and has all their baby teeth out. So usually, anytime from age 11 and up. So there's no real, right age to do it. It's basically when we need to use that to move teeth and there's enough room to use that to place that TAD. That's a good time to do it. There's not really any age restrictions other than if someone has baby teeth and all their permanent teeth haven't grown in yet, that wouldn't really make sense to try to use a TAD at that point. So hopefully that makes sense. TADs, they might look a little scary, but it's easier than getting, a filling done. It's easier than getting a tooth pulled. Most people have had some sort of dental work before. It's easier than all those things. A lot of people are really nervous about it. A lot of times when we place them, they're always like, well, that was it. So it's easier than, getting a piercing, I think, for sure, because you're not really numb for a piercing. With this, you are numb. So once you get the little shot, you don't feel anything after that, and it's not too big a deal. So we don't use a ton of them. We use them when they're needed, and that might be, 2 to 3% of patients might benefit from a TAD. Not very many. So hopefully you found this video helpful. If you did, give the video a like, subscribe for more braces-related content. Make sure to tap the bell for notifications. And if you have any questions you'd like to have answered, ask them in the comment section below and we'll do our best to answer. Thank you so much for watching. We'll talk to you soon.